Here on Democracy Now!, democracynow.org, the War and Peace Report. I'm Amy Goodman. We're on the road in Denver, Colorado, as we continue our special coverage of the first presidential debate, expanding the debate. This is what democracy sounds like. As President Obama and Mitt Romney squared off in Denver Wednesday, we broke the sound barrier by expanding the debate to include two other presidential candidates in real time, the Green Party's Jill Stein and the Justice Party's Rocky Anderson. We turn now to Social Security. During the official debate, moderator Jim Lehrer asked Obama and Romney if there are any differences in their views on Social Security. This is President Obama.
I suspect that on Social Security, we've got a somewhat similar position. Social Security is structurally sound. It's going to have to be tweaked the way it was by Ronald Reagan and Democratic Speaker Tip O'Neill. But it is, the basic structure is sound. But I want to talk about the values behind Social Security and Medicare, and then talk about Medicare, because that's the big driver of our deficits right now. You know, my grandmother, some of you know, helped to raise me. My grandparents did. My grandfather died a while back. My grandmother died 3 days before I was elected president, and she was fiercely independent. She worked her way up, only had a high school education, started as a secretary, ended up being the vice president of a local bank. And she ended up living alone by choice, and the reason she could be independent was because of Social Security and Medicare. She had worked all her life, put in this money, and understood that there was a basic guarantee, a floor under which she could not go. And that's the perspective I bring when I think about what's called entitlements. You know, the name itself implies some sense of dependency on the part of these folks. These are folks who've worked hard, like my grandmother, and there are millions of people out there who are counting on this. So my approach is to say, how do we strengthen the system over the long term? And in Medicare, what we did was we said, we are going to have to bring down the costs if we're going to deal with our long-term deficits. But to do that, let's look where some of the money is going. $716 billion we were able to save from the Medicare program by no longer overpaying insurance companies, by making sure that we weren't overpaying providers. And using that money, we were actually able to lower prescription drug costs for seniors by an average of $600, and we were also able to make a significant dent in providing them the kind of preventive care that will ultimately save money throughout the system. So the way for us to deal with Medicare in particular is to lower health care costs. When it comes to Social Security, as I said, you don't need a major structural change in order to make sure that Social Security is there for the future.
We'll follow up on this. First, Governor Romney, you have 2 minutes on Social Security and entitlements.
Well, Jim, our seniors depend on these programs, and I know anytime we talk about entitlements, people become concerned that something's going to happen that's going to change their life for the worst. And the answer is neither the President nor I are proposing any changes for any current retirees or near retirees, either to Social Security or Medicare. So if you're 60 or around 60 or older, you don't need to listen any further. But for younger people, we need to talk about what changes are going to be occurring. Oh, I just thought about one. And that is, in fact, I was wrong when I said the President isn't proposing any changes for current retirees. In fact, he is on Medicare. On Social Security, he's not. But on Medicare, for current retirees, he's cutting $716 billion from the program. Now he says by not overpaying hospitals and providers, actually just going to them and saying we're going to reduce the rates you get paid across the board. Everybody's going to get a lower rate. That's not just going after places where there's abuse. That's saying we're cutting the rates. Some 15% of hospitals and nursing homes say they won't take any more Medicare patients under that scenario. We also have 50% of doctors who say they won't take more Medicare patients. We have 4 million people on Medicare Advantage that will lose Medicare Advantage because of those $716 billion in cuts. I can't understand how you can cut Medicare $716 billion for current recipients of Medicare. Now you point out, well, we're putting some back. We're going to give a better prescription program. That's $1 for every 15 you've cut. They're smart enough to know that's not a good trade. I want to take that $716 billion you've cut and put it back into Medicare. By the way, we can include a prescription program if we need to improve it. But the idea of cutting $716 billion from Medicare to be able to balance the additional cost of Obamacare is, in my opinion, a mistake. And with regards to young people coming along, I've got proposals to make sure Medicare and Social Security are there for them without any question.
This is Democracy Now! Expanding the debate with the third-party presidential candidates, Rocky Anderson and Jill Stein. Jim Lehrer has just asked about Social Security and the so-called entitlements. Dr. Jill Stein.
Yes, I think first it's very important to point out that while we hear a very different narrative from Barack Obama and the Democrats than we do from Mitt Romney, with Mitt Romney's narrative being usually harsh, scary, selfishness on steroids, and the Democratic narrative being warm and fuzzy and we're all in this together, let's just wait for things to get better. You know, it's really important to look beyond the talk, to look at the walk, to look at what's actually being proposed. And Jeffrey Sachs at the University of Columbia has pointed out in his analysis of the budget proposals of both Obama and of Romney-Ryan, points out that they're both aiming for essentially the same targets. They're both aiming for Social Security to be about 5% of GDP some years down the line, whether it's 4 or 8 years. And on Medicare, they're both aiming for Medicare to be reduced to about 3.2% of GDP. So the point is, while they have different scenarios, they both have the same targets. Obama himself is also looking to cut non-security discretionary expenditures, things like that cover education and housing and job training, also looking to cut that nearly in half, according to his own budget figures, down to about 1.8% of GDP from 3.2% where it is right now. On Social Security, Obama is already calling for some cuts, basically to the cost of living reimbursements. So heads up about what's going to happen after the election. You will see the walk differ from the talk. And on Medicare, yes, it is true they are both proposing the same changes. Again, a sign that things are really not different between these two corporate-sponsored candidates. They're both proposing about $700 billion in Medicare cuts. We can fix this. For Social Security, we simply need to raise the cap on Social Security. It will be perfectly solvent when the rich are paying their fair share. And on Medicare, one thing we can do right now is to fix Medicare Part D so that it's no longer a boondoggle, a giveaway for pharmaceutical companies, and to allow bargaining and negotiation to get bulk purchasing and bring down the cost.
Rocky Anderson, you have 2 minutes.
Thank you. The solution to Medicare is to provide Medicare for everybody, to make it a single-payer system. You look around the world, Canada, Taiwan did a study. They looked at all other nations' systems, and they incorporated the very best elements. And they have a single-payer, basically Medicare for all system. And we are paying more than double the average of the rest of the industrialized world per capita for our health care costs. A large part of that is because we're relying upon the for-profit insurance industry to provide health care for most of the people in this country. We need to get rid of that. We can control costs in all of these systems. And by the way, there's not another nation in the industrialized world that does it anywhere like we do, that has the waste, that has the poor medical outcomes, and where people are taking out bankruptcy by the hundreds of thousands. So that is the solution for Medicare. We can make it affordable, we can provide better services, and we can do it for all. You just get the for-profit insurance companies out of the way, and all of the burdensome paperwork and the different billing systems and all the rest that end up costing over 1/3 of what we pay for what's supposed to go toward our medical care. As to Social Security, the Social Security payroll tax is as regressive a tax known to mankind, because if you make $110,000, you don't pay anything on the income over that amount. Everybody pays the same thing up to that point. We need to lift that cap. You could reduce the percentage that workers pay. You could bring it down to 4%. so that the middle class and the working poor come out ahead. You lift the cap, and then you also have those who make their money through investments pay their fair share as well. There's no reason why working people are paying towards Social Security and those who are living off their investments get away once again without paying their fair share.
Back to presidential debate moderator Jim Lehrer.
Now let's move to health care, where I know there is a clear difference, and that has to do with the Affordable Care Act, Obamacare, and it's a two-minute new segment, and that means 2 minutes each, and you go first, Governor Romney. You wanted repealed. You want the Affordable Care Act repealed. Why?
I sure do. Well, in part, it comes again from my experience. I was in New Hampshire. A woman came to me and she said, look, I can't afford insurance for myself or my son. I met a couple in Appleton, Wisconsin, and they said, we're thinking of dropping our insurance. We can't afford it. And the number of small businesses I've gone to that are saying they're dropping insurance because they can't afford it, the cost of health care is just prohibitive. And we've got to deal with cost. And unfortunately, when you look at Obamacare, the Congressional Budget Office has said it will cost $2,500 a year more than traditional insurance. So it's adding to cost. And as a matter of fact, when the president ran for office, he said that by this year he would have brought down the cost of insurance for each family by $2,500 a family. Instead, it's gone up by that amount. So it's expensive. Expensive things hurt families. So that's one reason I don't want it. Second reason, it cuts $716 billion from Medicare to pay for it. I want to put that money back in Medicare for our seniors. Number three, it puts in place an unelected board that's going to tell people ultimately what kind of treatments they can have. I don't like that idea. Fourth, there was a survey done of small businesses across the country. It said, what's been the effect of Obamacare on your hiring plans? And 3/4 of them said it makes us less likely to hire people. I just don't know how the president could have come into office facing 23 million people out of work, rising unemployment, an economic crisis at the kitchen table, and spent his energy and passion for 2 years fighting for Obamacare instead of fighting for jobs for the American people. It has killed jobs. And the best course for health care is to do what we did in my state, craft a plan at the state level that fits the needs of the state. And then let's focus on getting the cost down for people rather than raising it with the $2,500 additional premium.
Mr. President, the argument against repeal.
Well, 4 years ago when I was running for office, I was traveling around and having those same conversations that Governor Romney talks about. And it wasn't just that small businesses were seeing costs skyrocket and they couldn't get affordable coverage even if they wanted to provide it to their employees. It wasn't just that this was the biggest driver of our federal deficit, our overall health care costs, but it was families who were worried about going bankrupt if they got sick. Millions of families all across the country. If they had a pre-existing condition, they might not be able to get coverage at all. If they did have coverage, insurance companies might impose an arbitrary limit. And so as a consequence, they're paying their premiums. Somebody gets really sick. Lo and behold, they don't have enough money to pay the bills because the insurance companies say that they've hit the limit. So we did work on this alongside working on jobs because this is part of making sure that middle-class families are secure in this country. And let me tell you exactly what Obamacare did. Number one, if you've got health insurance, it doesn't mean a government takeover. You keep your own insurance. You keep your own doctor. But it does say insurance companies can't jerk you around. They can't impose arbitrary lifetime limits. They have to let you keep your kid on your insurance plan until you're 26 years old. And it also says that you're going to have to get rebates if insurance companies are spending more on administrative costs and profits than they are on actual care. Number two, if you don't have health insurance, we're essentially setting up a group plan that allows you to benefit from group rates that are typically 18% lower than if you're out there trying to get insurance on the individual market. Now, the last point I'd make before
2 minutes is up, sir.
No, I think I had 5 seconds before you interrupted me. Was the irony is that we've seen this model work really well in Massachusetts. because Governor Romney did a good thing, working with Democrats in the state to set up what is essentially the identical model, and as a consequence, people are covered there. It hasn't destroyed jobs, and as a consequence, we now have a system in which we have the opportunity to start bringing down costs as opposed to just leaving millions of people out in the cold.
We are expanding the debate with the third-party candidates. Rocky Anderson of the Justice Party, health care.
Well, we're talking here about Obamacare and Romney care. I would call it insurance company care because they're the ones that wrote it. They joined up with a very conservative foundation years ago to develop this plan to make the American people buy this perverse product. Again, we're the only country in the world that depends upon for-profit insurance companies for the majority of our coverage for health care, for those who are lucky enough to have it. There are now over 50 million people without basic health care coverage in this country. The latest report indicates that there will be over 30 million people without essential health care coverage when Obamacare is fully implemented. That means misery, it means extended disease, it means extended illness and injuries, and it means the loss of lives. Now over 40,000 people in this country die every year because of the lack of health care. And I talked earlier about the enormous rates of infant mortality and maternal mortality. These are women and children dying primarily because they don't have access to health care, and there's still going to be that major problem. And watch your premiums skyrocket. It's already happened since the beginning of this program, and it's just going to get far worse. So what we need is what the vast majority of Americans said they wanted during the health care debate. There were some 70% or more people, and the majority of doctors saying, we want a single-payer Medicare for all system. President Obama and his compatriots that were colluding with the insurance companies wouldn't even let a single-payer Medicare for all proposal see the light of day in Congress, and then the president folded even on the idea of a public option. It was an enormous betrayal of the public interest so that they could please the for-profit insurance company that has such a stranglehold on our Congress and now on our White House.
Dr. Jill Stein, this is your profession, healthcare.
That's right. It's my profession, and this is where I live. I live in the state of Massachusetts. So I've seen the Affordable Care Act. We also call it Romney Care or Obamacare, take your pick. We've seen it actually roll out, and what we've seen is that the Affordable Care Act actually, in the flesh, is neither affordable nor caring because, in fact, it provides stripped-down plans which are fairly expensive unless you are in a very low income, unless you're poor and you're covered. Costs go up astoundingly. So if you are making less than $20,000 a year as a family, you're covered, and it actually has expanded care for the very poor, and that's a good thing. But if you're in that $20,000 to $40,000 bracket, so near poor and fairly poor, I think by many standards, actually your costs go up 5% of your income, which is just a staggering amount of money to add an additional 5% of your income to your health care costs. And yet you are not covered. So on average, these plans cover about 75% of your costs. Or actually, I think it's more like 70% of your costs, yet you're paying approximately 10% of your income for them. So it's not affordable for families. You're not fully covered. The proof of the pudding here is that when people get sick in Massachusetts now, they go into medical bankruptcy just as much as they did before we had the Affordable Care Act. And it's certainly not affordable for government, not for state government, not for municipalities, not for small businesses. Costs are skyrocketing, and it's cannibalizing all other aspects of budget. The answer here is Medicare for All, which provides care for everyone comprehensively. You are in charge, not your boss at work or not a profiteering CEO, but you get to call the shots. And well-kept secret. It actually saves us trillions of dollars over the coming decade because it eliminates that massive, wasteful health insurance bureaucracy, and it stabilizes medical inflation. So it is a win-win. It's absolutely, it's a sign of how hijacked Washington and our state capitals are that we don't have Medicare for all right now.
Green Party presidential candidate Dr. Jill Stein and Justice Party's Rocky Anderson, as they participated in the presidential debate last night in real time at real podiums, albeit in a different place. On Democracy Now!'s special broadcast